a viewing of my guy right here, Colin, film, and he's gonna explain what it is, because I wasn't prepared for this part. And if I start talking, I'm not gonna stop. So I'm gonna pass it on to Colin.
Who are you?
My name is William G. Miller Jr. And I already referenced to the junior because there was the late William G. Miller Sr. And I'm just an advocate for harm reduction and been doing harm reduction work around the nation for a little bit and continue to do it. And I'm glad we can actually see this viewing and have a panel afterwards, because that's what it'll be. Hopefully people can stay for the panel afterwards. And also questions, we have a Q&A afterwards. But I want to get Colin to introduce the film so we can get started.
Thanks, Will. Thank you all so much for coming to this and just being here. It's really amazing that to have a space like this where this film can hopefully spark some conversations and be a useful tool. For me, this film's a love letter to a community I was part of for many years, and I moved to the U.S. in 2016. Sort of right as fentanyl was hitting the streets there. So my wife and I were kind of listening from a distance as people we loved were passing away. Seemed like almost like every week or two we would hear another name. And I have done lots of kind of film stuff, like awareness and educational kind of videos for different organizations in the neighborhood for many years, and wanted to try and just capture what was going on out there and shine a light on the frontline workers. There was a lot of kind of attention about the paramedics and stuff, which obviously the crisis affects a lot of people and it's tough on everyone, but no one was really talking about the community members themselves that were kind of the real frontline workers or the real first responders that were training themselves to respond to an overdose and doing whatever they had to do to keep each other alive. In a lot of ways, it's a community that has sort of been abandoned or just failed by society, and learned to just take care of themselves. And you may have to see like 2 intros of me, which I apologize for, because there was one recorded thing that I had to do for someone, so it's probably kind of repeated. But the line that I used there, which is kind of just like, I think people who use drugs, are some of the most criminalized and stigmatized and people in our society, and they're often pushed into the shadows. And to me, that's about a community that is about those shadows fighting back. And so, just thanks again for being here, and hope you enjoyed it, and really looking forward to the discussion and everything after.
Hi everybody, I wanted to thank you all for coming. This was more than magical. I'm the leader of a coalition called the Bridges Coalition. We were tabling outside, but we are a coalition made up of 30 plus organizations and individuals for overdose prevention sites in Baltimore City and Maryland abroad. If you want to join our coalition, we do a lot of advocacy work and community-based work, and we would love to have you be a part of the fight to get overdose prevention sites in Baltimore City. I'm gonna pass it over to the panelists. I can introduce.
Yeah, introduce the panelists. That'd be great.
Cool. This is Stacy. Stacy is one of our panelists. Do you want to introduce yourself?
Hi everyone, good evening. My name is Stacy Jefferson and I'm with Behavioral Health System Baltimore. We are also a member of the Bridges Coalition. And I just want to welcome everyone today. Give yourselves a hand clap for coming out tonight.
Good evening, everyone. My name is Jason Beltray. I am Director of Community Initiatives at On Point NYC in New York City. We operate the first 2 overdose prevention centers in the United States.
Hello, my name is Shelley Johnson. I am a part of Be More Power. I'm doing outreach with Narcan, and I'm also a part of the Will Senior Power Group.
And we only have 3 mics, so there you go. Yeah.
Again, my name, thanks for coming out again, as echo what Stacy said. Appreciate that. You can be anywhere, but you're here watching this with us and supporting us. It's something that I dearly embrace, that hold close to my heart. My name, again, William Miller, and I'm here on behalf of Will Senior Power Group, and that's a remembrance of my dad. So, I'm gonna ask the panelists a question, then we're gonna have time for Q&A from the audience if there's any. But as I'm also a part of the Bridges Coalition also. As many of us in here, so if y'all are part of the Bridges Coalition or would like to be, please find someone and sign up so you can be on our regular monthly meetings and our policy meetings also. So with that said, from the time from this bill first being put in, Stacy, and to now through policies, changes and change of administrations and just in Baltimore City, as well as the state of Maryland, but we're gonna start with Baltimore City right now. And then you also can hit on the state of Maryland. How has the momentum changed with this conversation in Annapolis about overdose prevention sites coming from 6-7 years ago up until this point?
So one, we can see how the momentum changed, but just how many people are in the room today. We started, as Will said, this has been a labor of love for about 7 years. A bill had been introduced in the Maryland General Assembly during the legislative session for 7 years. Delegate Dan Moorheim has championed that issue in the beginning. And so we really have moved forward. So Bridges Coalition was formed as well about 6-7 years ago. And during that time, there was a small group of us who gathered, who were talking about safe consumption sites at the time. That's what we were calling it. And so at that time, we really were just a small group talking about what seemed like a pie in the sky idea. Just conversations in the community, continuous advocacy in Annapolis as well as in Baltimore City has brought us to where we are today. So today we have a mayor who is in support of overdose prevention sites. We have more and more groundswell of community that both understand and is supportive and would like to see overdose prevention sites in their community. We have legislators across the state who now understand the importance of this life-saving measure. And so we have come really, really far. But again, we could just look around the room today and see how far this movement has come. How many conversations has brought us to where we are today.
Thank you. And this is not just about Baltimore City. However, it starts with like how this conversation starts. Who started talking about it? And that's why I had a chance to visit On Point in New York. Well, I met this gentleman and another gentleman, Axel, who didn't come. But he had a real like significant job about everything else. Because when we talk about overdose prevention sites, when we first started safe consumption, it's just what they gonna go in and shoot dope or do this and do that. And it had to be some framework started. So I got Jason down here, and it was imperative that I did for him to explain his role and how the foundation was laid with him and continuously to still lay the foundation, being where will these sites will be in any part of Maryland, Baltimore City. So Jason, could you explain your role and how I just was stuck on that when I was talking to you and why you're here now?
I appreciate it. Thank you so much for the platform, man, and for allowing me the opportunity to speak here today. So as Director of Community Initiatives and Impact, I have a very diverse role in the organization. I'm responsible for a lot of the outward-facing messaging and programming that the organization has. So for example, one of the biggest programs that I run is the Outreach and Public Safety Team. This is a group of harm reduction specialists and managers that are out in the community and they're doing the good work, right? They're being they're doing the magic. They're being the harm reductionists that we need to be, distributing Narcan, intervening in overdoses, right? Being our ambassadors and delivering that message to not only people who use drugs and program participants, but community members, elected officials, law enforcement, right? So they're really like our eyes and our ears, and I've been fortunate enough to be able to grow that team into 20 like plus staff and have like groups of people, teams of harm reductionists out in the community, just getting that feedback for us, right? Actually doing that engagement. I know it's tough to make that happen in a lot of areas because of funding and other barriers that we face as harm reductionists. But they have the tough job of dealing with overdoses as they happen in the street and in the parks and in the playgrounds and things like that. But on the brighter side of it, they also have the pleasure, or we also have the pleasure of engaging like community stakeholders and like I said, elected officials and law enforcement. So one example is our relationship with the school that is located right across the street from our Harlem overdose prevention site. And they have the community faces issues with it, but we pose ourselves as a solution to these issues, right? We want the same things that the community wants, right? We want to prevent overdose deaths. We want to reduce the amount of syringe litter. We want to reduce the amount of public drug use that is occurring in schools and in playgrounds and in local residential areas. So this is us presenting ourselves as such, right? And then again, just doubling down on the messaging that this is not only about drug consumption, right? This is a public health intervention, right? We talked earlier about how the primary goal here is really or started as, right, reducing the amount of HIV and Hep C infectious diseases being spread. From that, it transitioned into saving lives and preventing overdoses. But the stars really had to like align for this to happen. Like, without the conversations that are happening here in Baltimore and Philly and Rhode Island and on the West Coast, right, in San Fran, and even, what's happening back home in New York, to piggyback off of what Stacey said, that momentum has been changing in so many different ways. With all of our voices being amplified and us as organizations and harm reductionists organizing better and communicating and strategizing, we've been able to really move the platform forward.
And to give them some kudos. For Jason, explain how long y'all been in existence and how many overdoses has been reversed and how many 911 calls has been decreased.
Yeah, sure. So On Point as an organization is fairly new, but we do have a history in New York City. So we actually started off as two separate organizations, New York Harm Reduction Educators and Washington Heights Corner Project. The landscape of HIV programming and funding, everything was changing because of what was happening with HIV. There were a lot of advances being made. On a wider scale, HIV patients are becoming undetectable, and as a whole, the disease was under control, for lack of a better word. And so a lot of organizations were kind of folding and going under. New York Harm Reduction Educators and Corner Project decided that they wanted to stay true to their mission of harm reduction, and so they decided to merge. This is a process that took some time. It started in 2016, and it finally went through in March of 2022. So we finally became On Point, no more NIRE, no more Corner Project. And from there, the overdose prevention site was born as well. So that was a program that we were able to launch on November 30th, 2021. We've been in operations just about 14 months, just over a year. To date, we've had over 700 overdose interventions. This is both sites combined, 700 overdose interventions, and these are all instances in which we didn't have to call 911, right? It has been a huge lift of burden on the community, on emergency response systems, law enforcement, right? All these interventions, we have 2,300 unique users registered to both combined sites, and we have a total of over 55,000 utilizations. These are all numbers as of January 2023. So when we want to talk to people about the impact that we have, right? We've diverted over 1.5 million units of hazardous waste. Part of the pleasure and my responsibility is I do a lot of community-based events. So sometimes during these events, I like to build a hazardous waste tree, because we can say, oh, we diverted 1.5 million. We can say that we diverted 1,000 units a week, or whatever the number is. But it's really a helpful visual aid when we have just like a base layer 4, 5, 4, 3, 2, 1, making a tree of like, this is the impact that we're having. This is the hazardous waste. This is the work that we're doing, because the conversations are happening in the room too many times without us as the actual harm reduction center. So it's just a powerful tool to convey part of the message. And on the other side of that, we want to talk about 700 overdoses. We want to talk about 50,000 utilizations. This again is all instances of diversion of public drug use, right? This is all stuff that these people who are using this are stabilizing out, right? Something that we observed in the very beginning when we started was people coming in and maybe being a little manic in their use, but after time, they realize that this is a service that's not going anywhere. That we're stable in our hours and we present as such, and so they follow suit, right? So now people are using less. Now they're engaging in a lot less risky behavior as well. So these are all the types of talking points that we like to take advantage of.
Just like years ago when our former mayor, my former mayor, Kirk Smoke, wanted to start syringe changing, like other things that to reduce the risk of HIV and Hep C. They thought it was impossible. Now that's like some of our number one engagement with people. So I have Shelly here that we did a hackathon last week, and we found out some interesting things in this hackathon. So hackathon is like, if people recall some Be More Power's Go Slow thing, it came from the Center for Communication program, and that's just like campaigning, start something from scratch. And there was a lot of disparities within, and one of the biggest disparities was about the woman voice. I mean, it is like arena, in this field, and like period, organization-wise, things like that. And it's primarily men being dominant of it, and women not being heard, especially a black woman in Baltimore City. So Shelly, been working for Be More Power doing outreach for a while, and also supports other advocacy efforts also. So I just want Shelly to speak on like some of the conversations during outreach, like that you heard, that people, may want to benefit from it, or some of the positives that you heard about it, and why it's needed.
The main thing that I wanted to say that, like you said, there's a lot of disparities. Very, very rare do you hear about the African American women, their voice and what we think needs to be done and what could be more helpful. So during the hackathon, like you said, it was an awesome experience because everyone got to bring their voice to the table. Everyone was heard, and like you said, it's going to be a lot more things coming up where we can address and hear the voices of African American women, because most of the time it's unfortunately the men and the women come in, their needs are even greater, because you got to think a lot of the times the women, we have the children, so that's one thing that makes it a little bit harder for us to actually get the resources and the help that we need, because there's so much that comes along with so with that being said, I'm going to make it my business to make sure I open up an avenue where more African American women can speak and get their needs met, because I think predominantly, unfortunately, it's more addressed towards men. It's more centered, would you say that, Will, that it's more centered towards what the men need, and their needs are more, I guess,
It's
heard more so than African American women.
And it become a power dynamic that we try to like break down, as well as systematically with things. And a facility such will have more into it, opposed to just people using drugs. And that's the bigger part of the picture that we was trying to get through. Also, it's not just a legalized shooting gallery, what we used to hear. It has so many resources in it, and it started with the ground, people on the ground, grassroots, doing outreach. Jason, like, get in the community, because Jason, like, I'm just intrigued by it, because Jason can ensure the school across the street that everyone on that front, those people who utilize this OPS will not be across the street.
Yeah, I wanted to piggyback on that too, what Shelly said. It's about, and part of what we do at On Point as well is we try to be very intentional and conscious of what we're doing, right? So, like you said, sometimes it becomes geared toward the male gender, and then we become conscious of that, and we gear the programming towards that, right? So it's like we have women's support groups, and we have there's a variety of them, a sexual health group for women, and a women's support group on Friday nights as well for sex workers, and and so it becomes a task, because you have to make sure that you're inclusive, right? But we're up for the challenge, right? That's why we're here, to make things better. But again, it reflects in the programming. So for us, with that intentionality, it's like we're listening for what the community needs, what our participants needs, right? So there's food disparities, shower, right? Laundry, clinical care, case management, right? We're trying to, for us, it's really about trying to take away all these like day-to-day survival needs that our people, the people that we serve are experiencing. And then once we take that off of their plate, they can really talk about what the core issues are, right? And then now we can talk about housing. Now we can talk about getting you re-engaged with a provider that you can trust, right? That relationship starts in the clinic, right? If you have one or if you can host one. But yeah, that really resonated with me. So I just wanted to add on about the intentionality and being conscious of like what the programming is and gearing it and being flexible to what the needs of the community are and adapting to that.
And we're gonna go into Q&A, but I want everyone to think about, we seen a film from Vancouver. Vancouver? Yeah, Lower East Side, Vancouver. We heard from Jason on Point, New York. It's no way we can mimic what they're doing. And think about ways how it's gonna look when it comes through. I'm speaking of for instance. I'm not saying if, but when, how it's gonna look. And I just know these people when. How it's gonna look in Baltimore City, how it's gonna look in Elton, things like that, if it was to be one. So let's think about that. And this just was something to bring it to light, more conversation, and any questions? Go ahead.
So first of all, thank you for a powerful evening. Thank you, Open Society, everybody else who put this together. My question is for the gentleman from New York City. You said part of your job description is about messaging the program. And I followed some of the progress of your program through the newspapers and TV. I'm wondering, what do you see the most effective 2 or 3 messages that you would take to Mayor Adams, who certainly is a law enforcement guy, and other people that may be resistant to the notion? Are there any quick formula messages that you think resonate well? Thank you.
Thank you, great question. So there are a couple, yes. There are a couple of messages we can take. I think the impact that we have on community, right? The frequency with which our services are utilized, and the fact that it's not only about consumption, but we have these wraparound services available, right? Everyone that comes into the building doesn't necessarily come in to consume. So that's point number 1. Funding a program like this will be such a lift on everyone involved, from law enforcement to emergency services, to social services, to it just goes down the line, because we're acting as that buffer or that front line to engaging with this population that has been so deeply stigmatized and entrenched in homelessness and mental health issues and things like that. So that'd be the first message. The first message is that this is the program. This is the answer, the unconventional answer, right? It's been, how long has the war on drugs been happening? That's not working. It's time to try something else, something with more compassion and humanity in it. Again, to piggyback off that, this is, it's saving a lot of money, bottom line. To this point, with the numbers compiled to date, I think we've saved New York City $20 million. And this doesn't even include whatever law enforcement dispatching occurs when there's an overdose call. This is money that can be used, if you're not going to fund an OPC with it, then you can redirect it into community programming, right? A rec center, or the school, redirect it into the school's budget or whatever. You can get creative with that. I think those would be the top 2.
Thank you.
Hello, everybody. How you doing? My name is Coley Tengela. I'm an OSI fellow using theatrical performance and filmmaking and storytelling to change people's ideas about negative social issues and put them into action. brilliant storytelling in the film. And the one point I really loved about was that it humanized individuals who use drugs as human beings. What I'm really proud to see that most of the panelists are African black folk. And what I want to know from you, that within us as a people, wherever we might be on the planet, how hard is it to change the horrible attitude and stigma and self-hatred of us as black African folk to view brothers and sisters who are dealing with the illness of drug use, not to demonize them and view them as not human beings? Because I see that challenge in the work that I do, trying to legitimize the stories of black folk who may be queer, women, and folk returning from incarceration. I feel it there. I know you must catch the blues when you try to tell particularly other black folks that black folks who are using drugs should have a safe space not to die and have some semblance of dignity. I don't want to speak for you, but I'm just very curious about how you might feel about that. And again, thank the filmmaker and all of you for the incredible work you do.
Thanks for that question. Ain't all that into life. I appreciate that. Thank you. I don't want me to. Oh, let's do that.
That was a very good question. And so I'll say that it has been difficult, but you know what? I'll use myself as an example. I grew up in Baltimore City. I was raised in the late 80s, early 90s, where the conversation around drugs was the war on drugs. It was don't do drugs. People who do drugs are awful. There were commercials about it. I know many of us remember them. And I'll say my opinion was probably skewed, even having family members who use drugs. And so it wasn't, I remember the first time, I always kind of joke about this, I remember the first time I heard about overdose prevention sites or safe consumption sites, and I was like, what are you talking about? You can't be serious. And so it took learning. The more and more I talked to people, the more open I was, the more I really understood that this saves lives, the more that I even was able to humanize those experiences and also understand that the war on drugs the purpose of it was to criminalize black and brown folk. And so more and more education, a lot of the conversations, I'm open with people. I tell them, I understand where you're coming from. I understand, I was there. And really talking to people about the war on drugs, the honest conversations around the war on drugs and how it really was a war on black and brown people. I think we're at a point now where those honest conversations are happening in other spaces when we're talking about other things. And so it's actually starting to get much easier to have a lot of these conversations. I had a conversation with someone before I got here today, another African American woman telling her about these spaces. And at a time where before, I'm pretty sure I probably would have got more pushback, this time she was really open about it. And she told me about her own experiences and how much this is needed. And so I think those conversations are really shifting because we're starting to understand a lot about society and many of the laws and policies that were put in place that before, we believed in. We thought we were inundated with images on how this was gonna clean up our streets and make our community safer, but then learned as we went on that wasn't the case. And that wasn't what they were trying to do. And so now, I honestly am finding that these conversations are getting a little more easier. Of course, people are this is still a new idea. In the United States, this is just not how we treat people who use drugs, and we haven't for a very long time. But people are starting to be a lot more open.
And this panel was intentional for the look who's on the panel. And sometimes you just have to be intentional with what you say, but it's how you say it. The fiscal year of 6/20 to 6/21, if I ain't mistaken, 1,028, 22 overdoses in Baltimore City, fatalities. I can speak more in depth to it and deliver it and be more intentional because my dad was one of those numbers. And I don't want to change their mind. I want to change their thought process to get them to think about it could be alternative ways that I don't have to relate, but I can understand why. And the conversation has changed so much. It's like I get people talking to me about how can we do it, when we gonna do it. Let's just do it. However, there have to be places, things put in place for that to happen, and we want to do it where though it doesn't do any harm to the people who may use the facility. And just because it's a facility put there, that don't mean people won't use it. So it's not going to be any added, like traffic, foot traffic or anything. The places that should be looked at are the places that already have the foot traffic. So that traffic will be organized traffic, coordinated traffic, like they do on Point. That's as you see in the film, they was outside, and that was the same traffic that was there. It was just for something for them to do at the times that they were open. I'm intentional with everything, and I have to be empathetic to people ignorance at times, but I don't mind talking to them and putting it in views where they can understand.
I just wanted to add a quick point. I think societal stigma is like hard to combat, but what I try and do is just combat stigma in my own personal circle and with my friends and try and hold the people I love and those who say they love me accountable to the language we're using and how we're treating people and making sure that aligns with how we're actually treating those individuals. Yeah, but I wanted to say thank you so much. We kind of need to wrap up, but thank you so much for coming. This was a beautiful screening and panel.
Give yourself another round of applause for showing up. I thank you.
Yes, and if you're interested in being in Bridges, contact me at cola@baltimoreharmreduction.org and we'll talk. Yeah, and we have a table. Grab some resources. Thank you.
Yeah, y'all didn't mean. That's what I was talking about. Stacy, Jason Stacy. I know, New York. Yeah. I ain't leave.